Hello friends. Do you want to ace the med school exams? Docemy medical videos will help you succeed in medical school and score high on any medical board exam. We provide you with the most comprehensive video lecture series. Follow us for the most knowledgeable and dedicated medical experts and professors as they bring their medical knowledge to your PC, tablet or smartphone.
Dear friends, I am Dr. Nishant B. Singh.
Teaching surgery from almost 24 years now. Being an academic teacher on the ground, what I would have to say is surgery is one subject you need a lot of common sense, and that is the most important thing in surgery.
Orthopedics is one of those clinical subjects where you can easily fetch some good amount of marks if you get to know some of the fundas.
Now fibroadenoma can be asked as a short question of 2 or 3 marks. It can even be asked as a 1-mark question.
Nephrotic syndrome is definitely not just about looking under a microscope and seeing a bunch of glomeruli in different ways.
Chest X-ray is the most common investigation that you will come across in your clinical practice.
But before going to the topic proper, I would like to give you an overview regarding how to approach a question in an exam.
The word ascites is derived from the Greek word askos.
Spondylolisthesis. So don't get wondered by seeing the puppy on the screen, right? So that's the famous Scottish Terrier.
So fat soluble vitamins are vitamin A, vitamin D, vitamin E and vitamin K.
Because your oncotic pressure comes down, what happens? You start losing water from inside the blood vessels.
It is not an abnormality. It is just a rift from the normality or an aberration in the normal development and involution.
The test it should include total protein, albumin of the ascites fluid, total count of the ascites fluid, differential count of the ascites fluid.
I already said it is basically a surgeon's disease. So whenever it is possible to resect, you resect the tumor completely.
So now we started him on steroids. We started him on daily steroids at 2 milligrams per kg. Now what do? We do a daily urine protein estimation.
Rotation, orientation, phase of respiration and exposure.
This was actually taken 2 days later when he had full-fledged lesions. So you can see there are erythematous lesions.
And in case of instability, if the spine is unstable, you need to fix it, and we call it fusion. So decompression plus or minus fusion forms the surgical management part of a spondylosis.
All these 3 principles, the learning pyramid, as well as the Feynman's technique, as well as the glasses model, you can see a common trend, which is the best way to retain something is to explain that in our own words.
Highly qualified medical professionals and experts joining hands to help you for your medical exams. Come, join us for the virtual medical lecture. Docemy.